Hi, everybody. Thank you for taking the time to be here with me and learn about Teethan. First of all, let me introduce you myself. So let me tell you a little bit about myself. My name is Martina Palmieri, and I am the head engineer of Teethan. And I have a master's degree in biomedical engineer, so I'm not a dentist myself. Today, in the time we're together, I will tell you a little bit about our technology, Teethan, a little bit about ourselves, so the company, and the main purposes and uses of the technology. So let's start with this concept, dental occlusion. I think that dental occlusion is something that I do not have to teach you at all. It's more the other way around. But this concept wasn't always that clear to everybody. This is our experience starting from 10 years ago when we first launched the technology here in Italy. So the plain and simple definition we can give about, natural alignment. Okay, dental occlusion is natural alignment between the upper arch and the lower arch. And even though this concept is very, very easy and its physiological aspects are very easy as well, not many people, for example, patients, are aware of how much this simple concept can affect all other districts of the body. For example, simple gestures like chewing or swallowing or the entire posture are very, very much affected by malocclusion. So the absence of a correct dental occlusion. And, I was telling you before, we are an Italian-based company and we developed the technology here with our universities, and then we shared our knowledge with other, academia specialists across the globe. And the thing that struck the most to us was the fact that the World Health Organization, so WHO, shared this tremendous data about the fact that the prevalence of malocclusion is generally across the globe expressed in medium terms 56%. More than half of the population is affected by this kind of issue, and just in Europe the prevalence is almost reaching the 75%. So 2/3 of the population here in our continent is affected by malocclusion. This is something that we want to fight, and we cannot fight, of course, because we are not dentists, but we want to give you the tools to fight this kind of issue because it's something that has spread a lot, and this data is not even updated after COVID. So it's just something that was calculated before, and WHO is not able yet to give us data because the COVID has changed everything. And so we are expecting this data to grow exponentially with the new release of this information by WHO. So why Teethan? Why Teethan comes in the market in the first place? So we are present in the market from 2015 as a company, but we were developing our technology way before that. And we have now, and I'm proud to say that, established a good reputation in Italy, first of all, and in Europe. And that is something that has led us to, open our borders even further and share what we have now acquired as experience of our customers with all other dentists across the world. So Teethan is the number one medical device, which is entirely wireless. So it doesn't have any kind of cable across the entire technology, which is able to detect the neuromuscular balance of occlusion. So one thing we always say about our technology is that we do not want to, give an alternative to the presence of a clinician. It's not at all our mission, it's not our goal, it's not the way that the product was, developed and thought. We want to complement what the clinical experience has taught you through the years and enhance it when possible and support your clinical decisions and help you predict the clinical outcome that you will get from your decisions, treatments, and therapies, and have you access some quantitative data that is not possible to have any other way. So the reason why you find palpation and articulating paper represented in this slide is because I want to introduce to you, these two concepts, because palpation is just a procedure that can, many of you, I'm sure, will still be using after, getting acquainted and maybe choosing Teethan as your new technology of the office, because it's something that is very quick and easy to, help you assess the health of the masticatory muscles, but it's not something that will ever give you quantitative data, and that's something that I know I'm sure you're all aware, and so this is why Teethan comes in handy. On the other hand, articulating paper is just it's what I like to call the other half of Teethan, and so the combined use, and we will see it in a little bit, the combined use of articulating paper and Teethan is just the full picture of your patient's health, and it will get you to a point where you will be able to predict better and always better how your treatment will be received by the neuromuscular system of your patient, as well as by the morphological aspect of your patients. So let's see a little bit masticatory muscles when they are, working. So what I want to show you is this video, which was provided to us by some designer guys that share their knowledge about anatomy in this, very interactive way. And it's just to show you how masticatory muscles help the mandible to move, to open and close back. So the first muscle you're seeing here, the upper one, is the temporalis anterior, as I'm sure you know. And then we see also the masseter one. So Teethan was born after the realization by Professor Ferrario here at the Milan University of Dentistry in the early 90s. So Professor Ferrario realized that if he was able to, produce a very strict protocol to analyze muscular activity of the masticatory muscles, of course, he will be able to take into account also the functional aspects of a rehabilitation, of a therapy which may be based only on, morphological aspects, or a therapy which may be based only on the way that teeth occlude with one another. And so seeing how much these two muscles are able to let the mandible come into place, it's a very strong, again, concept. And so what Ferrario did was create a scientific protocol, and then followed a lot of scientific articles, which we are very happy to share with you, if you please. So our technology is based on the assumptions and the verification and the validation that Professor Ferrario did for us. And so to sum up all the things that I just throw at you, Teethan is a device that allows you to quantify the activity of the masticatory muscles, being the temporalis anterior and the masseter muscles. So when Teethan detects that those muscles are working in a balanced way, then you can have a full-on report telling you that the neuromuscular aspects of your patient are in order. So they are not something to be worried about when you proceed with your rehabilitation or therapy. On the other hand, when the Teethan report expresses an imbalance of the masticatory muscles activity, that is something that should alarm you, in the sense that can, interfere negatively with your treatment and your plan of treatment and the duration of your treatment and the clinical outcome of your treatment. So what I've just told you, and all the things that I've just introduced to you, and we will see in detail as we go on with this webinar, is all based on this new technology, which we introduced and we patented and we developed and we take care of it every single day, which is called electromyography. And it's the technology that allows for the quantification of muscular activity in general. We developed a specific kind of probe, which is the one you are seeing right now on the screen, which is first very compact, very small, very lightweighted, and it's meant to be, of course, worn by the patients without the actual patient feeling like they have something strange on their face. So the probes are meant to be, not even percepted by the patients after they have it on for the first 2 minutes. And they are based on this differential technology, as we say, in the sense that we do not just read the signals and the electrical activity of the muscles from one single point. We do it from two different sets of points, and then we compare the two just to make sure that there is no noise due to other biological structures like blood or hormones or other muscles that we do not want to detect and analyze. And so just with the hardware part of the system, we are able to cancel 90% of the noise that we would be capturing otherwise. So this is something about the technology. Other things that compose the system are the USB receiver on the left. You have it here. It looks like a USB key, but it's just like a little antenna that is used for the probes to be put into communication with the actual software and application you will have on your laptop. On the right, on the other hand, we have the charging station. So it's where you will put the probes once you've done your acquisitions, and you can charge them back, you can turn them off, and you can store them safely with them being attached to the charging station. So one thing that we always kept in mind when designing the product was to make sure that we won't be disturbing you in any way possible. That means that the patient must not be, affected by the presence of this device on their face, as well as we do not want to take up too much of your space in the dental office. And so everything is very compact and can be stored in a very small space. So getting on into the actual, usage of the system. So my goal today is to give you a very brief introduction on all the aspects regarding this technology. So we saw a small introduction about malocclusion. We saw a little bit about how those two muscles, temporalis anterior and masseters, are working with the mandibule to produce occlusion and all the natural gestures that come along with it. And now we saw the technology just now, and now we're going to see a little bit about the use. At the end of this webinar, we will leave you the context that you will need to, if you are curious, if you want to, get deeper into the technology, just be sure to save the last slide, where you will find a QR code that will put you in contact with us so that we can give you all the information you may want from this. Okay, or either you can contact our sales rep and sales director. Okay, so let me show you a little bit about the actual usage. So this video is very helpful because it's so short, because it's just the actual usage of the system. So the probes are magnetic, meaning that they can be turned on just by swiping them on a magnet, which is placed on the charging station. So you do not have any, buttons that can be pressed by accident by, the patient maybe scratching their head. It's very safe from this point of view. So we have a magnet on the single probe. We swipe the probe on the magnet of the charging station, and the probe will automatically turn on, and the LED on the probe will tell you if the probe is on or off. So you see, a very quick gesture is nothing common. You can do it with gloves on so that you don't have to take them off before, starting your treatment. And the probe is very compact. It's very easy to detect. Going on, once the probes are correctly on, you can see directly with me today how quick and easy the system provides you with data. Before seeing the video that I have here on the slide, which will take, I think, 1 minute of your time, I just want to spend some time describing to you what the actual test is and how we are able to tell you that muscles are working in a balanced way or in an unbalanced way. So today we will see the occlusal test, which is our first clinical protocol, and is the one that most of our customers use on a daily basis because it allows them to immediately understand if there's something going on they should be worried about. And so it's very quick and easy to acquire, and today we will see that. So the occlusal test is composed by two main phases, one being the calibration and one being the natural occlusion test. So why do we need these two different phases? The calibration test is performed because we want the technology to adapt to every single patient and not the other way around. So we want the technology to be able to build a baseline, which is patient dependent. And we want the technology to be able to give you dentists an information which is ad hoc to every of your patients, which will have different biological patterns, different biological structures. And we want the technology, again, to be adapted to the patient and not the other way around. So the calibration is performed by asking the patient to clench as hard as possible on two cotton rolls, which are to be placed between the first and the second premolar. We play the recording. The recording will start as soon as we hit the button, and then will stop automatically after just 5 seconds. So the entire calibration test will last 5 seconds. Afterwards, once we are satisfied with our calibration, which we can repeat as many times as we want, because again, we want the patient to be able to feel confident and feel comfortable as well, so that we are representing the true neuromuscular health of the patient. Afterwards, as I was saying, after the calibration, we go on into the natural occlusion test, which is performed again by asking the patient to clench as hard as possible, but removing the cotton rolls. This test is the one that you can then perform on your oral appliances. For example, if you want to see if your provisional prosthesis work is well accepted by your neuromuscular system, and we will see it in detail in a bit, you can test the provisional with Teethan and compare it with maybe the first exam you did on the patient when you were studying the case or when you were designing the treatment. That comparison will allow you to understand how much the prosthesis has, been accepted by the neuromuscular system of the patient. So at the end of the natural occlusion test, which lasts again another 5 seconds, so between the probe's placement and everything, the test will last 3 minutes and even less once you get acquainted with it. So at the end of the natural occlusion test, the software will give you automatically the report, and so all the data you need, and you won't have to save it or think about how this data is stored, because it's something that the software does automatically. So let's have a look at the video here. Let me remove the audio for a sec. So you see, the software is not something meant to, put you in trouble if you have maybe an assistant helping you with the acquisition of the data, whatever you want. It always reminds you of the steps that you need to perform in order to get the good and reliable and trustworthy data that we give. So these pop-ups that you see here are just a reminder of what the test should look like. Okay, so first, calibration, 5 seconds. I have given to my patients the color rolls. I asked them to clench as hard as possible, okay, for 5 seconds. And once I'm satisfied, I see the preview on the left, and now I will pause the video. So immediately when doing the calibration on the left, the software tells you how the distribution of muscular activity is. So each muscle, the 2 masseters and the 2 temporalis anterior, have a color coding, which is always the same throughout the entire application, which will give you a quick and intuitive distribution of muscular analysis. So for example, in this case, I see a huge prevalence of the left masseter and of the right temporalis. So just to show you, for the purposes of today, I will show you how a second calibration will look like compared to the first one. I can select, you see, one on top of the other. I can select the one that I want. I go on into occlusion and I hit record again. 5 seconds without color rolls. The system tells me you've done all you had to do, and the report, so the results of the test, will come up immediately after. Okay, so today it's not my goal to go deep into the meaning of each index, into, the technical aspects of each index. I just wanted you to see and have a feeling of how the data actually looks like. If for a second we forget about the numbers underneath, just look at the picture at the center of the screen, which I will indicate to you here. So this is what we call the occlusal plane. The occlusal plane is just a simple representation of how the muscles are actually working right now, and where do they have applied pressure and force on the context. Okay, so we are seeing here 2 targets with 2 arrows, the pink one being the application of force by the masseters, and the blue one being the same thing about the temporalis anterior. So here I see that the force and the couple of forces produced is concentrated on the anterior part of the mouth, which is something we want to avoid. And it's something that we want to avoid so much because the global index, which is this red ring here, the number and inside this ring, is something that it's a global index, indeed, that represents the global score of occlusal balance. 38 out of 100, which is the maximum number you can get. It's a very alarming data. And it's very alarming also because all of these numbers that you see here represented all have normal ranges calculated on population without malocclusion, scientifically validated, and everything we spoke about before. So this is the quickest way to analyze how muscles are, being collaborative with my restoration, with my rehabilitation, with my therapy. In this specific case, we have no collaboration whatsoever by muscles. So going on into what Teethan is used for. So we saw before that we have a quick glance of the neuromuscular balance of occlusion. And I know that some of you will think, okay, and then what am I going to do on a daily basis, when I have my patients with me, when I have to design splints, when I have to, test my provisionals, etc. So the main usages of Teethan in dentistry are the ones that you saw represented here in the slide. So first of all, the reason that Teethan was born is to detect neuromuscular imbalances, which can then be, causes or effects also of TMDs. So the TMJ overloads is something that we really care about, and it's something that we developed the technology for at the beginning when we didn't know how many other things could be done with Teethan. So another is to find the best DVO, so the best vertical dimension from a functional point of view, of course. So this means that when you are in front of decision of what kind of vertical dimension to choose for your patient, and you go on and you decide to choose the one that morphologically makes more sense, you with Teethan are able to understand if that vertical dimension is also accepted by the neuromuscular system of the patient. And if you have an easy mouth, as we like to call it, then you will see that you have a very wide range of choices for your vertical dimension. Otherwise, you will see that the musculature won't be able to express all of the force required to, move the mandibule as physiologically required. The third point is balanced splints. So this is something very crucial, and this is something very important that we will see in a little bit. According to the muscular activity of temporalis anterior and masseters, one can be able to, calibrate their splints in order to maybe alleviate some of the muscular tension that is due to, maybe some dysfunctions or whatever the case may be. Speaking about prosthesis is the same reasoning that we apply for the DVO. So when I test my provisional, my definitive restorations, I want to make sure that yes, I'm giving, the morphological best outcome to the patient, that I fix his occlusion or her occlusion or whatever it may be. And then also I want to make sure that I'm not disrupting the neuromuscular balance, or if I'm required to disrupt it, because it's the only way that I can do it, I want to make sure that the muscle retrain, that the muscles start to, get acquainted with this new occlusion. And then through my follow-ups, maybe I will see that the patient has learned to deal with this new occlusion, and I've produced a better condition to my patient. The second to last is preventive breakage. That is something that we've seen happen a lot with our customers, and the fact that you with Teethan can take into account overloads impressed by the muscles to your occlusion, it's something that it's very, it's priceless, because it helps you, as I was saying at the beginning, it helps you with predicting how the outcome of your treatment will be, because you take into account every single variable that there is to taken into account. And then the last one being, when I'm doing orthodontic treatment, I can see if the patient can undergo such a treatment, maybe because it has a very strong musculature, or if he needs some training before undergoing orthodontic treatment, because maybe it is a subject which can be, affected by dysfunction. There's still no symptoms to be seen, but still, I want to make sure that an orthodontic treatment won't be, getting into the surface some kind of dysfunctions. So let's look deeply into the three main fields of application of Teethan. The first one being the prosthetic treatment. So in the planning and implementation of a prosthetic rehabilitation, Teethan allows you for the evaluation of neuromusculature balance of course, the stomatognatic apparatus. So as I wrote on the slide, the loads imposed on the joint by muscles that are not working properly can compromise the outcome of the rehabilitation, either with fractures or with prosthetic failure, as well as with patient dissatisfaction, which is a very important thing to take into account. So it is critical to take into account muscle activity here, because it will let you to, and you will see it, trust me, it will reduce your time of therapy for sure, as well as increase the patient comfort, because you will take into account the aspects that the patient is not able to tell you in any way. So how do we use Teethan during a prosthetic rehabilitation? First, into the case study. So when I have the patient with me for the initial diagnostics exam, a Teethan test allows quickly for the patient muscle balance to be assessed in a digital way without, disturbing the patient at all. So we can certify if there are dysfunctions, we can know the distribution of muscle loads on the occlusion, so we can find the right balance between function and aesthetics, and also we can have in quantitative information to support the decision making. So then when we go on into the mock-up realization and the case design, we can perform Teethan tests to, guide us into the corrections to get, yes, a centric occlusion for sure, but also a centric occlusion which is accepted by the neuromuscular balance. So, for example, for each change of the mock-up, we can do a Teethan test, which you saw it takes just 1-2 minutes. By keeping the probes on the face of the patient, you can test as many changes in the mock-up as possible, just to get to the point where you have a good muscular balance. So when then you go on into delivering the provisional, you can assess if the modification on the mock-ups have been conserved and have been, kept constant by placing the provisional. You can touch up the provisional as the same way you did with the mock-up. And then once you get to the delivery of the final prosthetic with Teethan, once everything is healed, you can test if this final prosthetic is keeping all the work that you've done with the previous steps. So this is a way for you to always keep in mind that muscles can be trained and patient can compensate, but to a certain extent. So by doing Teethan exams in those 5 steps, comprised of the, of course, periodic follow-ups, 12 months, 24 months, whatever it may be, this helps you keep in front of you the info about if everything from a neuromuscular point of view is going according to plan. Let's talk also about splint therapy. So, a splint therapy, and this is something very obvious that I'm going to tell you, is generally designed to prevent teeth from making contact with one another. So we are able to free the mandible and the temporomandibular joint from an obligatory position, which was thought to be the best one by the mastication. So when a mandible is released from the occlusion that was imposed before, the muscular forces are able to express in their entirety. So then how can we take into account everything? So both the need to, free the mandible and the fact that we want muscle, once we have freed the mandible, to work with the joint and not against the joint. So first, again, case study, when I have my first visit with my patient, I can check in a diagnostic way how muscles are behaving, how muscles are, working day to day. And then I can, again, certify dysfunction that may be present, understand how, forces are being applied to the teeth. And then when I get to my splint design and I want to test maybe different appliances, I want to make sure that this device is better than another device. I can do everything with Teethan. So I can test maybe Teethan with the oral appliance number 1, and then with the second, and then modify the second to be, more occlusion centric and whatever you may want. And so as we were talking about before, when you have patients with a good mouth and with a good ability to compensate, maybe you won't see any differences between, using an oral device of one kind and one of the other. And with Teethan, that gives you the information about how easy that mouth will be to rehabilitate. Because when the muscles are very flexible and they are able to, react quickly to any change in the occlusion, you are in front of a patient which is it has an easy mouth, as I've told you many times in this webinar before. That doesn't mean that your restoration will be easy. I'm sure about that. It's just that the muscles of your patient are ready to, to not fight the change, but to, work with the change that you're making to the occlusion. Same thing for delivery and verification. You will be able to check that the occlusion you wanted to give to your patient has been accepted by muscles as well, so that throughout the entire time that the patient has to wear the splint, the muscle won't be working against the splint, will be working with the splint to put the mandible in the position that you want the mandible to be placed in. Same thing for periodic follow-ups. Last but not least, let's look at the orthodontic therapy. So, here we cannot say the same exact things we said before about prosthetics and splint therapy, because when you're doing an orthodontic treatment and you are, moving dental elements, and so you are rotating or displacing or whatever you may need to do, that's a period of time in which muscles will undergo an unbalance and a little dysfunction, if you know what I mean, in the sense that we know that when you are changing occlusion in the way that you do via orthodontic treatment, we know the muscles won't be in balance for some time. So what Teethan comes in handy with here is, of course, the case design, case study. So the first visit, or, the diagnostic visit, because when you are approaching an orthodontic treatment, function can be, an element of disruption for the therapy, because if muscles are not ready to undergo the changes that you're going to produce to the occlusion, they will be keeping the contacts as they were before. So the fact that maybe testing the muscles before undergoing an orthodontic therapy will allow you to predict better the outcome of the therapy itself. Because if muscles are prone to be trained, then the repositioning of elements in the dental arches will be easier for that kind of mouth. Otherwise, if muscles keep on working the same way that they did before, maybe your elements will go back to the initial position. So, for example, another concept that is very helpful here is the fact that, of course, we want to assure to our customers and our patients the best aesthetic outcome possible, and the one that they required, and maybe the one that they got into the chair first. But the main important thing here is to make sure that those aesthetic results are not in conflict with the neuromuscular occlusal balance, because the problem there could be that after some time muscles will try to move your correction to the initial position. That's the real issue here. And so being able to build the therapy also the aesthetic outcome based on what the muscles can bear. That is something that will give you a very long lasting treatment. Another step, which is very important, it's the end of treatment verification. So once, for example, all the liners of the treatment have been worn and everything is okay, and you think that the treatment is done, checking quickly with Teethan how the muscles are doing after the treatment can be a very good indicator of if there is something left to do, maybe functionally, just functionally, not aesthetically, maybe to, refine the treatment just to make sure the muscles won't be interfering with the new position of teeth. And at the end, the periodic follow-up, just as before, will help you to check if muscles are, as I was telling you before, trying to move again the dental elements into position. One last concept that I want you to bring home with you, and thank you for your patience if you are still here listening to me, is the fact that Teethan is not an articulating paper and it's not something that it's against articulating paper. As I wrote in the slide, Teethan do not substitute articulating papers, but it complements them fully, meaning that as we have a technology that is not able to tell you punctually how contacts are between the dental arches, we are here to tell you that if you do a Teethan exam and then you use an articulating paper or similar kind of device, you will get a one-on-one relationship between what muscles are doing to each contact. And once you correct the occlusion, going back with the Teethan exam will give you the full picture and will give you not just the perfect occlusion for your patient, but also the perfect occlusion in time. So I have told you everything that there is to know about the technology, even though I did it in a high level of detail. Okay, so now I just want to, I'm not a dentist, I'm an engineer. So I know there's some things to my eyes look in a different way with respect to your eyes. So I wanted to leave you with some of the comments that colleagues of yours here in Italy, but also in Spain, in Europe in general, have said about us. So maybe some of these names are familiar to you. Maybe there are people that you've been collaborating with or in contact with, even just on LinkedIn. And so I wanted to leave you with their ideas about our technology. And these are all people that are using the technology now for 8, 9, 7 years, 10 years, even more, when it was just a prototype. And they have been so happy with the technology in terms of clinical outcome, of the relationship that they have with their patients, and the ability to know well before how a treatment is going to look like on the mouth of the patient. So thank you for being here with me tonight and to, being able to listen to me to the end. As promised, I will leave you to our contacts. You can just scan this QR code to, get acquainted even better with our technology, get in contact with a specialist of the technology, or either your sales manager person that will be able to assist you with every doubt and information that you want. I hope I was clear enough. I hope that you had an amazing time with me, and I hope to see you soon, maybe if you don't already have it, with our technology in hand and in your dental office. Thank you so much. Take care.